Okay. Hi, everyone, and welcome back to another session. Today, we are joined with Dr. Khan, who is going to be teaching us about general dentistry. So, hi, Dr. Khan. Thank you so much for joining us today.
Well, thank you. I apologize for the technical difficulties. I was just telling some of you guys that I got stuck with an emergency. So a patient walked in at about 4:15 and she's like, I really need you to do this before the end of the year. And I'm like, damn it, I can't say no. So my apologies, you guys, for being late.
No worries.
All right, so I'm going to get started just so that we have enough time. So just quickly, a little bit about myself. So I'm originally Canadian. I completed my dental school from the University of Toronto. The requirements are the same. I did another presentation when they were really interested about what's school like in Canada, and I assure you it's no different than school in the States. What I did do is I did write the Canadian boards, and then I wrote the US boards. And then I worked in a remote area in Colorado for about a year. And currently I'm with a corporate employer. So I've been working for a total of 3 years, and basically in the process of locating my very own dental practice. And then some of the things that I specialize in my practice are I do a ton of Invisalign. I do a lot of cosmetics, and I do place implants. You can go next. Perfect. So my journey to being a dentist has been a little bit non-conventional. So I was pre-med. I wanted to be a neurosurgeon. And then I did a gap year just because I didn't get into the school I wanted to. I had to get in there for personal reasons. But then I had a gap year. So I ended up doing a master's in business. And then I worked corporate marketing, got into dental school the year after, worked corporate marketing and went to dental school. So I have 5 years of corporate marketing experience. But the huge benefit to that was because I worked throughout school, I came out of school with no debt, which I know is really rare. And I can kind of, it's something that I'm really passionate about. I discuss more on my personal social media pages, but that's just been something that, has really carved my dental journey. So, obviously always wanted to be a dentist, even though I did corporate marketing and I learned a lot about business, and that has helped me in dentistry. It wasn't my passion. So afterwards, when I did start my career in dentistry, took over 2,000 hours of CE and just really, really trained myself in the first 2 years when I graduated. Perfect. So general dentistry. So on the top, you'll see the WebMD definition of general dentistry, and then I'll tell you kind of what the real life deal is. So it's performing any mild to moderate dental procedures. So that includes fillings, crowns, bridges, veneers, extractions, dentures, basic orthodontics, and root canals. The reason why I say mild to moderate is basically anything too complicated is what you'd refer out to a specialist. So a specialist would include, a root canal specialist, so that's an endodontist, or an oral surgeon doing complicated surgeries, or a really advanced orthodontic case doing braces, things like that, you'd refer out. All right. So what is my advice? I'm going to keep it very, very simple because I overcomplicated my undergraduate degree and college and just tried to do too much at all one time. So my biggest advice would be to keep your prerequisite courses kind of top of mind and have the highest GPA in that, and then write your DATs early. So I challenged my DATs in my third year of school. I'd write them probably in the first year and the second year if I could do it all over again, just because if you have to rewrite, you're not stressed at all. I was pre-med, so I was writing the MCAT first year and second year. But then I just, realized dentistry was it, wrote that in my third and fourth year. When you do get into that process of getting into school, I would say the biggest advice I'd give you is do a mock interview. So I actually paid somebody a lot of money to mock interview. Now we have things like LinkedIn and Instagram and all these other places where you can find dentists or other students that just interviewed at your school. So ask them and just say, hey, will you mock me? And go into it blind and have them do a mock interview with you and give you some feedback. That's going to be very helpful. Now, the last piece of advice I have for, college students would be I know we're kind of obsessed with location and going to school. My biggest advice would be pick a school that has low tuition. So if you can stay at home and go to school, remember that means less debt when you graduate. And so when you do start earning, that's going to be a lot less, money that you're paying into your debt. You're saving more and you start earning a lot faster. All right. So if you guys have questions, by the way, feel free to stop me. I'm totally okay with that. So what's a typical day in dentistry? So that's kind of a typical day for me. So on the very right side, you'll see the hygiene schedule. So with COVID, you'll see that it's a little bit spotty. But normally we just have it back to back. So on the right hand side would be my 2 hygienists. And so I'd probably start the day, do some hygiene exams, and I'd hop over to the left side where I'd seat a crown and then start another root canal and do some crowns. At the same time, I'm hopping onto the right side, doing more hygiene exams, diagnosing treatment, seeing new patients. And as you can see, I did not get a lunch that day. So that's okay. That happens sometimes. Your procedures are going to run through. I got, I think, like a 10-minute lunch. Then in the afternoon, I had more treatment. And more hygiene exams. So, one thing that I will say that dentistry has over other healthcare professions is there's a lot of hopping and jumping back and forth. Patients like to get their stuff done and like to get their stuff done on time and fast. So if you're in between treatment and you're running your procedure's running late, you still have to find that bit of time to hop out, go do an exam, and then come right back. All right. So what are the most common kinds of complaints? So the most common is tooth pain, right? So when people will come to you when they're in pain, that's when they'll most come to you, and that's when they will be most willing to accept treatment. So that's kind of the most common thing. And you tend to get people doing treatment the same day on that day. The least common will be cosmetic dentistry. So it takes a lot of trust that you have to build with your patients or a really good cosmetic reputation to do a lot of large cosmetic cases. Typically, they're very expensive. So patients, I know on Instagram, you see all these before and afters, and people tend to think that's dentistry. That's probably going to be the hardest thing for you to break in through to, just because it is a lot of money for patients to come, and you need a really good reputation for patients to come to you for that. So typically you'll have to start doing only a few cases a year, and then you'll build on that, and then you'll get a really good reputation. But basically that's how you can do more cosmetic cases. Some of the other things that you will do are orthodontics. So people will complain about crowding, spacing, and with the advent of things like Invisalign, it is very normal for general practitioners these days to do some orthodontics. Okay. All right. So what do I refer out? This is where specialty comes in, and general dentists these days, we can do a lot of more moderate cases, but there will be severe cases in everything you do that you do have to refer out. So that'll include, for example, really complicated root canals, really complicated surgical procedures, any kind of TMJ pain or surgery. So that's kind of your jaw joint right here, and then advanced orthodontics.
Dr. Khan, I'm so sorry to interrupt you, but your audio is kind of muffled.
Okay, can you hear me now?
Yes.
So, okay, so this is one of the first few cases that I did. You guys are still okay to hear me?
Yes, we can hear you. You're good.
Okay. Okay, perfect. So this is one of the first few cosmetic cases I did. So this couple came in and they wanted to gift each other a brand new smile. So it was their 50th anniversary present. And so the first thing we did was, you can't just come in and do cosmetics. We have to first treat all the decay and the disease. So we did a series of fillings, crowns, root canals, get got him all sorted from a disease perspective. So that's the first step. The next thing we did was a smile makeover. So he ended up getting a combination of 10 new crowns and veneers, and you can see that in that second photo. And basically, we essentially just restored his smile completely. So that requires a full smile workup. We kind of show them what a potential before and after would look like. We then prep the teeth and then finally deliver the crowns. All right, so this was supposed to be a video on my Instagram page, but because of our audio video issues, we won't be able to see what the after was, unless you guys have that handy. But basically, this patient came to me, and you can see this case on my page. But basically, this patient came to me. She had a fall the day after the night of New Year's, and basically broke her two front teeth. Very young, beautiful lady. So the first thing we did was we referred her to the orthodontist first, just because she did have trauma to the teeth, and we made sure that these teeth were still fixable or restorable. And then all we had to do for her, and you'll see the after on my page if you ever visit it, but all we had to do for her was basically give her one veneer and one crown. And so basically what I'm trying to say is, when you do a cosmetic case, it's not necessarily a huge case. Whitening and like one veneer or two veneers can make a huge improvement. So gone are the days where you have to shave all your teeth away to get a beautiful smile. With a combination of orthodontics, whitening, and, just a few veneers, you can get really a pretty perfect smile. All right. So my advice to everybody would be, I know we're very obsessed, especially when we're in college, to kind of, focus on when we're going to get to that next stage. I would say not getting into my top school was kind of the best thing that happened to me, because I was able to go get all this business experience. And now it comes in handy because I can look at my profit and loss statements. I can look at my expenses and all that stuff. So my gap year was really a blessing in disguise. So I would say don't obsess over when you reach your goals, but more so just focus on, kind of getting there and figuring out what's the right time for you with your personal situation. If you work hard and you follow kind of those earlier pieces of advice, you will get there, and it'll be a pretty rewarding career. And that's it. You can obviously follow me for more kind of try to share my day and my tips and tricks and things that I do on a daily basis. You can always follow me there if you need to kind of catch up or ask me any questions.
Yes, thank you so much, Dr. Khan. Yoon should be popping back in with some questions that we received in our live chat. So, and we do have quite a few, but thank you. That was an amazing presentation, and I'm glad it was able to work out.
I'm so glad. Will you guys just read the questions to me?
Yes. Yoon should be compiling them right now, and she should be popping in shortly.
No problem. How's your evening been?
It's been great. A well-deserved break for sure.
Right? You guys are off, right?
For now, yes. Okay, while we wait on Yoon, I can go ahead and, I guess, ask some that I've seen pop up.
Okay.
So one of the first questions is, did you ever have fears that you wouldn't succeed as a dentist or fail in dental school?
Fail in dental school? Did I ever have fears? Of course I did. So I got into dental school, and within, I think, 2 or 3 months of dental school, my dad had a major stroke. And so I almost actually dropped out of dental school, because at that time I was also doing my corporate marketing job and making really good money, honestly. And so dentistry was never for the money for me. But I was like, well, I can just help my family out, and, I'm already doing okay. And so why do I need to absolutely be in school for another 4 years? So yeah, it was a fear, but I persisted because I knew that I would never be truly happy with just being in corporate America. And so I really did want to, work with patients and improve their smiles. Like that was something that I was passionate about. And I think if you just focus what you're interested in and not do something for the sake of being a doctor or a dentist, if you actually just do it for the sake of what that profession is, you'll be a lot happier and you'll persist. So you'll get over the failures.
Awesome. I definitely agree. That's some great motivation. Thank you. I know it gets a little hard for us, even now as pre-dents, to kind of try and cope with just trying to make it. So thank you for that advice.
Yeah, don't worry about failure. Failure is like, honestly, every time I failed, and I know in that moment, and I know when older people used to say that to me. I'm going to call myself older here, but when when older or mentors used to say that to me, I was like, they're just saying it because they've made it now, and now they think it's easy. But everyone goes through their fair shares of failures. No one's perfect. Like I was never a perfect GPA or a perfect DAT score. And truthfully, I will tell you, not every just because you have those things are not going to make you a good dentist, because no patient is going to remember how perfect the filling was. What they're going to remember is how you made them feel, how their patient experience was, and were they satisfied with their care overall. So I know right now you're obsessing over those things, and it's fine because that's the stage you're at, but you're going to get to a point where those things, looking back, are not going to matter as much.
Thank you so much for that again. I think Yoon got disconnected. I'm so sorry, everyone, for the difficulties. Let me attempt to try and let her in if I can.
I think Zoom is being a little tricky today.
It is definitely today. I guess it's on its own kind of vacation mode as well. um,
If you go to the chat, you may be able to see all.
Let me go ahead and try that. I just don't want to stop sharing. Okay.
Because I don't think we really need the screen anymore. So you can just go to the chat. Here, let me see if I can access the questions on my phone.
She hasn't went ahead and joined, but I have the questions here too, so I can go ahead and ask them for you. I think it's probably a problem with her Wi-Fi. I'm so sorry, guys, but thank you so much for tuning in today. We promise we'll try our best to let this go on. But okay, another question was, if you go to a Canadian dental school, can you still practice in the States? Like, I know you said you went to a Canadian dental school. What did you have to do, I guess, to be able to practice here?
It's exactly what you have to go through. So basically, Canadian dental schools are still ADA accredited. So as long as you go to school within Canada or the US, you should be ADA accredited, because they're technically following the same curriculum. So I went through exactly what you did. So I wrote the US board exams and the Canadian board exams. So whatever, I think it was the NBDE part 1, and then the part 2, and then the REB. So anything that a typical US student would go through.
Okay, awesome. The next question is, who do you usually refer patients with TMJ problems to?
So there is no specific TMJ specialty there's no formal specialty in dentistry, but a lot of GPs or general practitioners or some oral surgeons will actually go and they'll specialize in TMJ. So they'll get additional training. And that's what I love about dentistry, is you can figure out what you like and you can go specialize in it without a formal residency, with the exception of oral surgery. There will always be oral surgical procedures that you can't do. So you would there's usually in every area, there's a TMJ specialist or someone that's specialized in that area. And so you just refer there. That or the oral surgeon. If all fails, refer to the oral surgeon.
Of course. Okay. The next question is, what is your favorite dental procedure to perform?
Oh, that's so hard. So I always say, my favorite thing to do is surgery. I love getting in there. I love opening up the jaw for implants. Like that's my favorite part of the day, even though it's probably the most stressful in the beginning. So if I could go back, I would have done oral surgery, but just personally for me, another 4 to 6 years in school and then fellowship and all those exams personally weren't a possibility just because I was starting a family. But I love anything surgery.
Oh, I definitely agree with that. But surgery is so much fun to watch, even as now.
Right.
um, Yoon was able to join us. Hi, Yoon.
Yes,
Thank you
sorry
guys so
about
much for
that.
bearing with us on this stream. But yeah, she'll be taking over now with the questions.
Yes. Yeah, I ran into some technical difficulties. I
There
still
you
can't get
go.
on Zoom through my computer, so I'm on my phone. I don't know how the angles are, but so
It's
I guess
okay.
I think you just talked about the Canadian dental school question.
Yes,
Yes.
So
we. Mhm.
another question is, what is your favorite dental procedure to perform?
Oh, we just went through that
Oh, we
one.
just
I
went there.
think the
Okay.
stream is a little behind.
Okay, sorry about that. See, what is one challenging aspect of general dentistry?
One challenging aspect of general dentistry would be, um, are you talking academically or just like practically?
I think both.
Okay. I think okay, so the challenging aspect of general dentistry, unlike specialty, is you need to be decent in everything you do, right? I remember when I graduated, a lot of the mentors that I had, they don't really do root canals or they don't do a lot of surgical extractions. Like even now when I meet a lot of senior doctors, I'm talking 50 plus, okay, 50, 60 plus. They had the luxury to choose what they liked and just do that. I think gone are those days where you can do that. And so the challenging part is you have to be good, you have to learn to be decent, if not good, but decent at all procedures. So that includes root canals, surgical extractions, and all of those things. So that I think was the most challenging part because, in dental school, we were like, well, yeah, if I don't enjoy doing surgical extractions, I just won't have to. But when a patient walks in your door with dental pain, you have to address it. Doesn't matter what procedure it is. So that's kind of the most challenging part. Um, the practical part would be staff. So the hardest part of dentistry would be staff, managing your staff and retaining your staff. It's just really tough. You hire somebody and then you train them and then they get really good and then all of a sudden they leave. So in dental, the turnover is really high.
Thank you. So another question that we have is, how has COVID impacted being a dentist for you?
That's a good question. I did get that last week too. So I think overall, it has impacted dentistry in general. So, a lot of offices have gone under, especially offices that weren't doing well, were not able to keep their doors open. And so it goes back to my other point of, if you are able to offer all the services you possibly can, you'll do okay and you'll ride the wave. But if you are a niche office or you just like doing a certain type of procedure as a general dentist, it's going to be tough. So it has impacted business overall, but less for GPs that are able to do a wide variety of procedures because ultimately people are always going to need orthodontics or people are always going to need surgical extractions. Like that becomes more of a need based procedure.
Um, so can you share more about your experience working with corporate dentistry?
Yes.
Mhm.
Um, so corporate dentistry, I would say the biggest, um, this is a long conversation, but the biggest advice I would say is the employer you go for, the kind of employer you go for is really, really important. So the biggest advice I would say is talk to somebody that works for that corporate employer and see if they like working with that corporate employer and figuring out if you're happy doing the kind of work that corporate employer does, because corporate dentistry is very fast paced. But that doesn't necessarily mean that corporate employers are all bad. It just depends on the type of employer that you work with, and the type of dentistry they do, and you being okay with that kind of dentistry. Like, I wanted to do a lot of cosmetics and I wanted to do a lot of advanced procedures. So I couldn't work with all corporate employers or the ones that specialize working in really rural, remote areas. Um, but that's a topic that I go into a lot of detail on my personal page, just because it really is so employer dependent, the kind of experience you'll have. My, fingers crossed, my experience has been pretty decent. And I would still go back and work with my corporate employers.
Thank you. So I know, given the circumstances, in-person shadowing isn't really as widely available. So how would you suggest that students approach dentists for shadowing opportunities?
I think with social media nowadays, it's amazing how much you can learn online. So I don't so for me, I don't have the time to go and shadow a specialist in person. So there's so many mentors I follow on Instagram or I follow on social media that do live surgical procedures, that talk about certain things. And they're all mostly clinical. So it's good to kind of figure out what procedures and all of that. But there are a few doctors and dentists that are talking about the practical aspects. And I would say that's really good. By following their stories or following them on social media, now you can just learn a lot without physically being in an office. With COVID, like, I know we aren't even accepting any in-person shadowing, mentees. So it's really hard to do that now. But my advice would be, let things settle down with the vaccine, and those opportunities should be available. And most dentists I know would be open to that. But if not, like, just reach out to a dentist that you like, or that talk to, or follow on Instagram or whatever, and just ask them whatever question you have. I know most people are very willing to help.
Thank you. And so how would you say undergrad prepared you for dental school?
It didn't. It would be a lie to say that it did. I mean, I know there's all critical thinking skills with all the exams that we do and all that stuff. And yes, that's important. Like, I agree. Dental school prepares you a bit for dental school. But when you get into real life dentistry, I don't think you don't learn all the practical things in dental school. You'll learn all the clinical things. But B, I think it's when you graduate, doing a residency or a GPR, that's one place where you can learn a lot more of those practical things. But with experience, you'll learn all the other non-clinical things. But as for your undergraduate degree, I would say the biggest thing is just focus on the critical thinking, because that's going to come, that's going to be handy in whatever you do afterwards.
And how did you balance work and school?
So it was hard. It's not for everybody. And I would say balance is a bad word. I think overworked is a better word. And so I would go to school in the morning. So I'd get up at 5 a.m. and then I would do some work. So what I did was I basically helped really big brands develop their websites. And so I'd get up in the morning and I do a lot of the web development from 5 a.m. to like 7 a.m. And then I'd go to school. I lived really close to school. So I'd go to school. I start my classes at 8 a.m. And then I'd usually be done around 4 when I'd get home. And then from 4 to almost 9, 10-ish, I would be working. So I don't know if balancing is the right word. And truthfully, I will caveat it with this. Working full-time throughout dental school is not for everybody. Not everybody is capable of that. I was lucky that I had the training to work in something that paid really, really well. But I will say you can use your summers and your semesters off to get ahead of your finances. So there's an opportunity for you to, go out there and pick up another job. And even if you pay off your living expenses, that's a huge chunk that you have paid down even before you graduate. So working full time is not for everybody. It is very tough. And there were a lot of times where I look back and I'm like, oh my God, if I had just done dental school, my life would have been so much easier. But remember, if when we're going to school for 8 years, you have almost 7 summers in those 8 years to do something else. So if you make use of those summers, even if it's not every summer, you can help to pay down your debt quite a bit.
And yeah, that's quite amazing that you were able to work, because I worked and I don't think I could do it with dental school.
My classmates used to look at me like I'm crazy. It was, and if it didn't pay well, I probably wouldn't have done it.
And so let's see, I think, did you have any moments where like you felt like you wouldn't succeed as a dentist?
Did I have any moments? Yeah, I think when you learn how to do something for the first time, with dentistry being so non-theoretical, like it's theoretical, you can read how to do a filling all you like, but you're never really going to learn how to do a filling until you pick up that drill and you fill. And so at the beginning, when you see it, it looks so complicated that you get really, really overwhelmed. And I never had like, you know, a 10 out of 10 filling in dental school. Like I was like, oh my God, am I ever going to be good enough? And am I ever going to, be perfect? And what if my fillings fail? And what if they don't look perfect on x-rays? So I had all those hesitations just because dentistry is so hands-on. But I will say, when you graduate, no patient's going to remember how perfect your filling looks as long as it's functional, it's long lasting, and it's a good job. That doesn't give you the right to just go do all sorts of work. That's not what I'm trying to say. What I'm trying to say is, what patients are going to remember is how you treated them, what their experience was like, and how efficient you were with their time. So those are the things that if you focus on, you're going to retain your patients a lot faster. But of course, there were multiple moments where I was like, probably not going to be the best, cavity filler in the world.
So what are the benefits of general dentistry over specializing?
The benefits for me would be I can pick and do a wide variety of procedures. So like I said, I'm one of those people that I need to do a lot of things at once. I can't just be satisfied by doing one thing at a time. So, there'll be days where I'll do a ton of Invisalign, and then there'll be days where I'll do a ton of implants, and then there'll be days where I'll do a ton of cosmetic procedures. I like the variety. As a general dentist, you have to like variety. The benefits of doing specialty would be you just want to focus on one thing and you love doing that one thing, and you can do it all day, every day, and it pays a little bit better. So that is the benefit of specializing, but I truly enjoy doing a lot of different things. So that's where general dentistry comes in.
Going back to the cases you covered on the second case, can you share which tooth got the crown and which tooth got the veneer?
Yes. So the most broken up tooth got the crown. So that was, that one right there. And then the tooth right beside it on the left got the veneer. So that's it. And honestly, if you see that so last week I was doing another Zoom call and we played the guessing game. And I said, well, I showed them the after, and I probably should have put in the picture, but I showed them the after and I asked people, how many veneers and crowns do you think we do? And somebody said 12 and somebody said 10, just because with a little bit of whitening and, two things, we were able to achieve such a dramatic difference. But honestly, you don't need to, you don't need to do so much shaving to get a cosmetic difference. So that's all we ended up doing, just one veneer and one crown.
So do you have any suggestions on how people can practice to work better with their hands?
You will, so one thing that actually really helped me is playing a lot of spatial games. So when I was studying for the PATs, I wasn't really good at like spatial recognition. So I went online and I Googled spatial recognition games, and I ended up just playing games on my phone and on my laptop. Back then it was a desktop. And that really helped me, start to visualize things in a 3D way. Because when you can visualize things in a 3D way, you can work with your hands blind better. So that's kind of something that worked for me. I don't know if it would work for everybody. And then it's practice. Practice makes perfect. So the more years you get under your belt, you'll get there.
How was dentistry like working in a rural area?
Rural dentistry is good. So it gives you a lot of leadership. It'll help you develop your leadership skills because there won't necessarily be a specialist there to help you out, or another doctor there to help you out. So you may be the only dentist in a practice. You may be the only dentist in like 100-mile radius. So there's better earning potential because of that. You're your patient's only choice. And then B, it'll be a lot more that you have to take on earlier on in your career. But just like how you're their only choice, they're your only choice too. So you're just going to have to make it work. So you learn things a lot faster, I would say, because you can't just refer everything out to somebody else.
And you mentioned how you wanted to go into medicine. So how would you say the MCAT compares to the DAT?
Oh my God. For me, it was so much harder. So I did do the MCAT, and I wasn't terrible at it. Like, I was okay. The DATs is more memorization based, and the PATs is different. But that, honestly, with any prep course, you'll get down. With practice and prep course, you'll be able to master the PAT portion. But other than that, the DATs is more memorization. So that's what I would say is if you know the facts and you memorize, you'll be fine. Really. The MCAT is more critical thinking. Like, memorizing is only maybe 20% of it. 80% of it is going to be your test taking skills and critical thinking skills. So, you really just have to think a lot faster on the spot.
Going off of that question, if someone was debating between medicine and dentistry, how would you suggest they kind of approach it?
The way that I approach it is I shadow doctors in both of those areas. So when hospitals do open back up, if you are able to do that, that's great. So I went and I did a research intern. I wanted to be a neurosurgeon. That was like my big dream. And so then I went and I did a research internship with a lot of neurosurgeons and psychologists at Johns Hopkins, neurosurgeons and neurologists at Johns Hopkins. And so I shadowed with them for a whole summer. And that's what allowed me to realize that's not something I want to do. Like, it was just emotionally draining seeing patients that just couldn't do much with their bodies despite all this great training that we have to help improve their lives. You saw very little improvement, surgery after surgery after surgery. So I realized it was just not something that I was going to be happy with, because every day I came home and I was like demotivated, and then I shadowed a general dentist, and honestly, to go from neurosurgery to dentistry, people were like, what? Like, how does that even make sense? But I went and I shadowed a general dentist. And even then I was like, okay, well, now this is too simple. Like, this is, but what I loved about it was that there was this instant gratification. So a patient came in with tooth pain and you got rid of that tooth pain in like an hour, or a patient came in with dental pain or a broken tooth and you fix that tooth within like an hour or two. So what I liked was you gave your patients a smile or happiness right away, and it actually made me happier. So even though it paid a lot less than probably neurosurgery, it required less training. So I had a better work-life balance and I was able to make patients happier a lot faster.
Great. How do you manage between being a leader and a friend to the ones in in your office?
Oh man, that's so tough. Remember I said that's going to be the hardest part of dentistry, your staff. It's just hard to manage. I thought I was coming in with a master's in business and I will know how to manage a practice. It's really hard. It's day to day. I would say the biggest advice I would give you is treat your staff like family. Don't do anything to them that you wouldn't want done to your family. and then maybe they'll stick around, and maybe then they won't, but maybe they'll stick around then. But at the same time, I always have to say, you have to be true to yourself. And just because you want to treat somebody like family doesn't mean you sacrifice the quality of your care. I still don't sacrifice that. So it's this really fine balance, and it's really hard. Honestly, I can't say I have it 100% down.
And I think that's all the questions we have. Do you have any other questions?
I don't.
No, I just thought it was really interesting. I guess for you to take the MCAT and then also take the DAT, like the whole kind of, I guess, switch. Like it's amazing that you were able to, kind of tackle both, and succeed. And yeah, it was really interesting. And that's like one of the first times I've heard. I guess some pre-dents might start off as pre-med, but like I guess you actually like went through, so that was really interesting to hear. And thank you so much again for your advice about, just persevering and not giving up. It definitely resonated with me for sure.
Yeah, I wish I had shadowed when I was debating between the two careers. I wish I had shadowed dentists before my third year of college. Like I wish I had done it in the first year, because then I would have been able to figure out what I'm really interested in and not even have to write the MCAT. That's what I said about working smart and not hard. That's why I give people that kind of advice, just because it's like, if you don't want to do something, don't invest all this time taking these tests. And so if you can shadow and follow dentists and talk to as many dentists or doctors as you possibly can, like neurosurgery is a really, really long stretch. So I really wanted to make sure I would be committed to it before, and it was actually going to be something of interest to me before I actually ended up starting like a decade-long career.
No, for sure. And I guess I do kind of have a question, because there's kind of like a not divide, but I guess as you know, a woman, it's always like, I guess, different. Like, have you ever experienced any instances where, there's been like a patient interaction or something that's just kind of thrown you off anytime?
Yeah, no, women in dentistry, right? So unfortunately, it's reality of the world we live in. Still, women, especially younger women, are not taken as seriously as, an equivalent younger man leader. And I'm going to put it out there. We face it all the time, and it's hard. Like I'll give a patient or staff member a recommendation, and they'll just kind of, brush it. But if the same advice was given by a male dentist, it would be like, oh, but Dr. So-and-so said it this. And I'm like, I said it too, So yes, I think the way to battle that is by training yourself. So making sure that when you are speaking to your staff or to your patients, you come off really knowledge based and improving your skills. Because essentially, when you do enough things right, they won't be able to question you. So it is hard. The challenges are there, but you can definitely overcome them.
No, for sure. Thank you so much for sharing that.
We have a really interesting question in the chat right now. Is this a Canadian thing where you would write a test rather than saying take a test?
Right. My husband's right here, so I'm trying to ask him because he's Canadian too.
Yeah. Oh, yeah.
Is that a Canadian thing? Oh yeah. Okay, I guess. Write a test. Challenge a test.
Yeah, someone told me that before.
Oh, yeah. Maybe. I don't know. I go back to Canada now and I visit my family there, and I notice all sorts of things though. I'm like, we do sound different. But before, I was like, hey, English is English. It doesn't really, make a difference. But you probably, you're probably
things like grade 7 versus 7th grade.
Yeah. And we don't have that. The reason why I keep saying first year, second year, we don't have like junior, we don't have freshman. We don't have this terminology. So it's hard for me to go back and say, okay, like a freshman would be first year,
Yeah, we have someone in the chat who's also Canadian. They say right as well.
Okay, good. See? When I first came here, though, it was a lot of things. They're like, "What is that?" I'm like, "I don't know, just normal English to me." But now I can pick up on those things too.
And I think we are done with questions.
Okay, awesome. Thank you so much, Yoon. And thank you so much, Dr. Khan. I'm glad everything was able to go off without a hitch and we were able to persevere with this stream. It was really informative. Thank you so much for taking the time out of your day to join us today.
Of course, and I'm really motivated to help. So if you guys ever need anything, just because all these topics like corporate dentistry or debt management or all of that, all of these things are so different for everybody in their personal situations, their family situations. So if you guys ever need anything or just a piece of advice, you're welcome to reach out to me and I'll try to help.
Thank you so much.
Thank you.
For all of those that are on the stream, Dr. Khan's Instagram handle is right here. If you guys would like to follow her, maybe shoot her a DM if you would like any other questions answered. But thank you so much again, Dr. Khan, for joining us today in this presentation. We had a lot of fun. I'm glad we were able to finish strong. And thank you so much, Yoon, for also finishing strong. We were able to get it. So yeah. That's pretty much it for tonight's stream. Thank you so much, everyone, for joining us. I hope you guys have a great break, and we should be back the week of December 28th with a new session.
Thank you, guys.
Thank you, everyone.